mode.
Hello and welcome. This training will focus on health insurance affordability programs in New York State. This training is broken up in four parts. Each part will discuss one of the five insurance programs. The five insurance programs are MAGI Medicaid, non-MAGI Medicaid, Child Health Plus, the Essential Plan, and the Qualified Health Plan. So first we're going to begin with MAGI Medicaid. In this training, child advocates and volunteers will be provided with an overview of how MAGI Medicaid works. By the end of the training, you will learn what is MAGI Medicaid, what is the eligibility criteria, and how someone can enroll into the program. You will also get an understanding of how MAGI Medicaid consumers get access to care that they need, as well as learn about their appeal and fair hearing rights when things go wrong. Furthermore, this training will discuss other types of MAGI Medicaid programs, and lastly, we'll provide you with a list of resources for more information. First, what is MAGI Medicaid? MAGI Medicaid is comprehensive health insurance coverage. It provides an extensive list of covered benefits, which we will discuss in the next slide. It helps pay for medical costs of people with very limited income and resources, and it is paid by the state and or federal government. MAGI Medicaid is an income-based program, and so the income is based on modified adjusted gross income, hence the name MAGI Medicaid. Another name that is used interchangeably for MAGI Medicaid is expanded Medicaid. It was established under the Affordable Care Act as an option for states to increase the eligibility for households with income up to 130% of the federal poverty level, FPL. Please note that not every state expanded Medicaid. And not only did New York State decide to expand Medicaid, but they also included a 5% gross income disregard, bringing the income limit to 138% of the FPL. Now, what does MAGI Medicaid cover? It covers all medically necessary care. These include, and this is not a limited list, inpatient and outpatient care, mental health and substance abuse services, labs, prescriptions, and dental services. Unlike the medical part of the services, MAGI Medicaid only provides limited dental services. Okay? And to get a complete list of dental services, you can view eMedNe's website. This website is mainly for providers to obtain information under the Medicaid program, but the public also has access to it as well. One benefit that you will not find covered or is a limited benefit under other insurances is home care services. You can also find a complete list of covered services in the Medicaid Managed Care contract under Appendix K. We will discuss Medicaid Managed Care later in the training. One of many protections that MAGI Medicaid consumers have is protections from balance billing. Balance billing is when a provider bills the difference between the provider's charge and the amount paid by the insurance company. For example, if the provider's charge is $100 and the insurance pays $70, the provider may bill for the remaining $30. Once a provider enrolls and becomes a Medicaid provider, they are prohibited from balance billing any Medicaid consumer for services other than applicable copays. As a child advocate and volunteer, you will come across a lot of Medicaid consumers who are being billed by providers. Therefore, you as a child advocate and volunteer, you will need to know the rules when it is permissible for a provider to bill a Medicaid consumer. If a provider is an accepted Medicaid provider, they are required to confirm the consumer eligibility prior to providing treatment. If they do not, and they provide services and in turn find out that is not being covered by Medicaid, then they have to eat the bill because they cannot bill the consumer. The only circumstance in which a provider can bill a Medicaid consumer is in a non emergency situation where, one, the provider has advised patients that the services will not be covered by Medicaid, and two, or if they don't accept Medicaid, and two, the provider has obtained the patient's consent to be responsible for the services prior to providing them. You can find more information about balanced billing on the New York State Department of Health website. Also, you should view our medical billing training that goes over how to handle medical billing cases. Next, we will discuss the eligibility criteria for the MAGI Medicaid program. There are 5 eligibility criteria that a consumer must meet to qualify for MAGI Medicaid. The first criteria is category. Category is the population which the consumer falls under. The second criteria, which is sort of not really a criteria, but it's information that you will need to obtain in order to assess the client to see if they're eligible for MAGI Medicaid. So household size is the number of people who are considered as part of the household and must be included on the application. Next is income, and this program does have an income threshold limit. Then is the citizenship, immigration status, and finally, residency. Let's begin with the first criteria category. Consumers who fall under the following population is eligible for MAGI Medicaid, assuming that they meet the other eligibility criteria. These include adults who are between the ages of 19 and 64, and they are not eligible for Medicare. And we will talk about those who are eligible for Medicare. Then you have pregnant women, newborns and children age 1 through 18. And then finally, parents and caretaker relatives. So if you have a consumer who's a parent or a caretaker relative, is considered a MAGI category. If they are an adult over 65 and they receive Medicare or not, they can still get MAGI Medicaid as long as they are a parent caretaker of a dependent under the age of 18. The second criteria is household size, and this is what we definitely will need in order to pre-screen clients to see if they are eligible for MAGI Medicaid. So household is defined as a tax filing unit. All individuals claimed as a dependent on a taxpayer's tax return will be included in determining the taxpayer's household size. And the household size will determine which income threshold. And again, the tax filing unit is defined by the IRS, the Internal Revenue Service. The third criteria is income. There are different income thresholds depending on the category in which the consumers fall under. Right? So adults who are non-pregnant and between the ages of 19 and 64, their income threshold is 138% of the FPL. Now, consumers over 65, income limit is also 138%. But remember, these consumers are only eligible if they are a parent caretaker with a dependent under 18 living in the household. Children between the ages of 1 and 18, their income threshold is a little bit higher at 154% of the FPL. And infants less than 1 year old and pregnant women, their income threshold is even higher. It is at 226% of the FPL. The fourth criteria is citizenship and immigration status. consumers must have a qualifying citizenship immigration status, and these include U.S. or naturalized citizens, qualified aliens, so legal permanent residents, green card holders, refugees, asylees, battered spouses of citizens with VAWA, or family-based petition pending, and many others. Some permanently residing under color of law, including DACA, is also eligible. However, please note, PUCO is not an immigration term used by the United States Citizenship and Immigration Services, USCIS. It is only a term used to public benefits eligibility criteria such as Medicaid. And these individuals, like DACA, as long as the USCIS knows that the individual is here in the United States, so they may not have a status yet, but they do know that they are here, then they will be considered PUCO for the sake of Medicaid eligibility. The other immigration status is non-immigrant visa holders, and these are individuals who are here with work on a work visa or student visa. They may be eligible if they meet all the other criteria. Now, immigrants with immigration status who are not eligible are consumers who enter across border without inspection. So if they didn't get inspected when they crossed the border, they do not have an immigration status, so therefore they don't meet this criteria. Also, temporary visa holders, let's say the consumer visa expires and they're still here, so they overstay their visa, therefore they would not have a status and they are not eligible for meet this criteria for MAGI Medicaid. The last and final criteria is residency. Consumers must be a New York State resident in order to be eligible for MAGI Medicaid. Well, who qualifies as a New York State resident? Consumers must live in the state at time of application and also intend to remain indefinitely. The good news is that there is no minimum time limit to have lived in New York to establish state residency. Now, you have to prove your residency. For most consumers, they will just need a New York State home address. However, for non-immigrant visa holders, they must establish residency by answering affirmatively to one of the following residency questions, such as, have you or your children applied to adjust their status to become a permanent resident? Do they currently work in the state? Do they have children that go to school in New York State? Do they own their home, or do they rent a house or an apartment? If they can answer yes to one of these and provide proof, then they will meet the residency requirement. Now let's do an eligibility case example. Here we have Rose is looking to enroll into health insurance. She has just moved to Rockland County. These are the questions that you would need to ask Rose to see if she meets the eligibility criteria for MAGI Medicaid. First, you need to know her age, 25, right? Then you need to ask her what is her income, and we find out that her income is $1,100 a month from a part-time work at retail store. And then you ask, what is her citizenship or immigration status? And she tells us she's a U.S. citizen. Now, does Rose meet the MAGI Medicaid eligibility criteria? So what is her MAGI category? She's an adult because between the ages of 19 and 64, she's 25. She is a New York State resident because she lives in Rockland County. Citizen immigration status, she is a U.S. citizen, and her income is below 138% of the FPL. And in this case, Rose will meet the criteria and will be found eligible for MAGI Medicaid. Now, how does someone, once you have pre-screened your consumer, now you would need to know how do they enroll into the program. Applications are processed through New York State of Health Marketplace. And in the marketplace, you can apply online or by mail or by phone. If you do it by phone, their telephone number is 855 355 5777. If you wanted, if a consumer wants to apply by mail, they still will need to make a phone call and they will have to request for a paper application and for the mailing address. There are in-person assistance available through a navigator or a certified application counselor. And here is the website that they can obtain that information. Eligibility determination can take up to 45 days, 30 days for pregnant women and children. But for most consumers, their eligibility determination can be made on the same day that they completed the application. Once a consumer is approved, consumers must renew their coverage every year, and they should receive a renewal notice 2 months prior to their coverage end date. One good thing about MAGI Medicaid is that once someone is approved for MAGI Medicaid, they are guaranteed 12 months of coverage, continuous coverage, even if their income changes. So if their income goes above the income threshold and they're still within their 12-month period, they are able to keep it until the end of their 12-month coverage end date. If a consumer is denied MAGI Medicaid, and as a child advocate and volunteer, you find out and you pre-screen them and say, hey, they actually are eligible for MAGI Medicaid. Then you can help that consumer file an appeal through New York State of Health Marketplace. And from there, you'll be able to help the consumer file the appeal and represent them at an appeal. So what if the consumer has other health insurance? Are they still eligible to enroll into MAGI Medicaid? Yes. Individuals can have other insurance and still be Medicaid eligible, except individuals who are enrolled in Child Health Plus, which we will discuss in another training, New York State, any of the New York State uninsured care programs, such as ADAP and AHIP. And we'll explain those in a separate training. If a consumer has other insurance, and this will be considered third-party insurance, Medicaid is going to act as a secondary insurance in the payer of last resort. So if you have any other coverage, you must use doctors who accept both your primary and your secondary insurance to avoid bills. Now let's do an enrollment case example. We have Rose again, right? We found that she's eligible and now she has Medicaid coverage. But she started working full time and is making $1,500 per month. Her new employer offers insurance and she is eligible to enroll in their coverage. She wants to know if she can keep her Medicaid coverage. Can she? Yes. Rose can continue to receive Medicaid until the end of her 12 months of coverage. Remember, they have continuous coverage for 12 months, even though her income increased to $1,500. She must inform Medicaid of her changes of income and also inform them that she now has employer-sponsored insurance. Once Medicaid is informed, the employer coverage will become primary and Medicaid will be secondary. In this section, we're going to go over how MAGI Medicaid consumers access services that they need. There are two ways services are delivered, either through fee-for-service or through a Medicaid managed care. First, let's talk about fee-for-service Medicaid. So fee-for-service Medicaid is also known as straight Medicaid or regular Medicaid. Consumers enrolled with fee-for-service Medicaid must use providers that take straight Medicaid. They cannot use providers that do not take straight Medicaid. Once they see that provider will bill Medicaid directly for each of the services that that provider provided. And Medicaid has pre-established rates that they will pay for each coverage service. Now, Medicaid managed care is quite different. When someone enrolls into MAGI Medicaid, they first have fee-for-service Medicaid for the first month or two, depending on when they enroll. Then they may be required to enroll in the Medicaid managed care plan. All Medicaid managed care plans are HMO type plans. And if you want to know more about HMO plans, please review the Health Insurance Overview training. Consumers will have 10 days to select a plan once they receive an eligibility determination for Medicaid. If they do not select a plan within 10 days, they may be automatically assigned to a plan. But don't worry, they can change plans during any time for the first 3 months of enrollment and during renewal. A plan must be selected by the 15th of the month for the plan coverage date to start the following month. If the plan is selected after the 15th of the month, coverage starts after the following month, so that's about 2 months later. Some consumers are exempt or excluded from enrolling in the managed care plan, and we want to discuss that next. So who are exempt or excluded? Someone who are exempt, these are consumers who have the option and can choose to enroll in the Medicaid managed care plan or stay in fee-for-service Medicaid. Consumers who are excluded cannot enroll in the Medicaid managed care plan even if they wanted to. So here are a list of individuals who are exempt or excluded from enrolling in the Medicaid managed care plan. So individuals who are Native Americans, they do not have to. They are exempt. People with other primary insurance, so like third-party insurance, for example, Medicare or employer-sponsored insurance, they are actually excluded. They cannot enroll into a mainstream Medicaid managed care plan. And then individuals who are receiving like hospice or waiver services are exempt. One thing category I want to stress is individuals who are have chronic medical conditions and are actively receiving treatment at the moment with a specialist who does not participate in any managed care plan. You can get a 6-month exemption, but you can only get that 6-month exemption one time. So after the 6 months, those individuals will have to join a plan. Some covered services must be pre-approved before services can be covered. This is known as prior authorization. For example, ambulatory surgery is a covered benefit that requires prior authorization from the health plan. Consumers with fee-for-service Medicaid, in order to find out which services require prior authorization, would need to contact the Medicaid helpline, and there is the number. It is the providers who will request prior authorization through a system known as e-papers. And if the requested health service is denied, consumers can appeal their decision by requesting a fair hearing. And consumers with Medicaid managed care should view their plan policy for covered services that require prior authorization. It is the managed care providers who will contact the plan to request prior authorization. And if the requested health service is denied by the plan, that's when we urge the consumer to appeal through the plan. And one thing we want to stress is that although a consumer may receive prior approval, it does not guarantee services will be covered. For example, they may have approved it, but when they went to bill and they find out that the consumer actually Medicaid is not active, then of course it will not be covered, right? Even though they had the prior approval. So that's just one example of why a prior approval um, would not be covered even if it's obtained. Now we're going to talk exclusively about how to access care under fee-for-service Medicaid. Consumers can go to, again, any doctor or hospital that accepts fee-for-service Medicaid. Although they have the freedom to go anywhere, it is sometimes difficult to find providers. There are some small copays for certain services, and that is in the next slide. And you can also find the list on the New York State of Health Access website. If you want to see a list of covered drugs under the fee-for-service program, you can find it on Medicaid pharmacy programs on the link that is in this training. So here is a list of fee-for-service copays. So for example, if a consumer goes to the doctor and at a clinic visit, they will have a copay of $3. But here it gives you more details about the copay. So what is a clinic visit? It's any outpatient clinics and hospital or freestanding clinics such as a community health center. Now, there are some exceptions to the copay rules. So for clinic visits, if it falls under this particular type of clinic, there are no copays. For example, if the consumer goes to a mental health clinic or a family planning, prenatal services, alcohol, drug abuse, tuberculosis clinic, or anything like that, getting that type of service, then they are not responsible to pay that $3 copay. And you will see that same information listed for different types of service and the amount that they will have to pay. And that's really much it for fee for service Medicaid. Now let's move on to Medicaid managed care. As I stated before, all Medicaid managed care plans are health maintenance organizations, HMOs. And this is just like a quick chart to give a brief overview of how maintenance health HMO plans operate, right? So the plan type is in Medicaid managed care, of course, is HMO. Do they have out of network services benefits? No, except in emergency or a network inadequacy where the plan has to approve out of network provider. Will the consumer be required to select a PCP? Yes. Will there be a referral needed? Yes. Is there a monthly premium? No. And are there any copays? Yes, but they are very limited. So consumers must use doctors, hospitals, pharmacies, and labs that are part of their plan network, unless it's an emergency, like so they go to the emergency room and they receive emergency room services, or when the plan pre-approves an out-of-network services because there is no in-network provider. Once a consumer enrolls into the Medicaid managed care plan, they have 30 days to select a primary care provider. If not, one will be selected for them. Consumers can change their PCPs once a month. Consumers must also get a referral from their PCP to see an in-network specialist. To eliminate the need to obtain a referral from the PCP to see a specialist, a consumer will need to see often. Consumers with a chronic, disabling, or degenerative condition have the right to ask their PCP for what is called a standing referral. And this standing referral will allow them to see that specialist more than once or for a specific period of time. Not only do they get a standing referral, they will also have the right to access specialty care centers. So if a consumer has cancer and they want to see go to a cancer center, they should have the right to access that center. And if a consumer is denied any services, they do have a right to file a grievance. An agreement is if they are not happy with the services they received, and or an appeal if they are denied a service. And we will talk more about this in the next portion of this training. Some Medicaid managed care plans may offer additional services. So you may ask, well, if all Medicaid managed care plans work the same, then what is the difference? And so to attract some consumers, they offer these additional services, such as asthma case management, diabetes case management, or some school-based health clinic services. So if you have a consumer who suffers from asthma, has a chronic asthma condition, then you may want to look into managed care plans that offer the asthma case management program. Consumers enrolled in the Medicaid managed care plan will only have copays for their prescriptions. They will not have any other copays when they go visit a doctor or they at a hospital, inpatient care. They will not have any copays. Only copays is to will be for prescriptions. The copayment amount varies based on the type of drug. For example, if someone needs a brand name drug that is non-preferred, it will cost them $3. $1 for generic, 50 cents for non-prescription, etc. There is a $200 annual cap on copays per consumer. Once a consumer pays $200 out of pocket, they should no longer be responsible for any additional copays until after they renew their coverage. Consumers should receive a letter if they met that cap. Here's some more on the prescription benefits. Pharmacies cannot deny a prescription if a consumer is not able to pay. However, the pharmacist has the right to request a copayment each time a consumer needs services or goods. They have the right to ask a consumer for outstanding copayments the next time they come back to refill or get a new prescription filled, or use other legal means to collect copays that are due. So they can put those bills into collections. Now, there are some consumers who are exempt from prescription copays. So, for example, and this is not a complete list, children under the age of 21 or anyone under the age of 21 should not be paying copay prescriptions. Pregnant women during their pregnancy in 60 days postpartum, so after 60 days after the pregnancy ends, they should not be responsible for any prescription copays. And then you have individuals who have certain chronic illnesses. So someone with mental health issues, if they need into mental medications, they should not be subject to copays. Someone who wants birth control or family planning or tuberculosis drugs, there are no copays. And you can go to the New York State Department of Health website for a list of individuals or consumers who are exempt from prescription copays. Now let's talk about transitional care. Transitional care is basically allows a consumer to continue to receive services from their current doctor, even if that doctor is not in the plan's network for a fixed period of time. Consumers with a life-threatening or degenerative or disabling disease or condition, and they are receiving ongoing course of treatment, they are eligible for up to 60 days of transitional care. Pregnant consumers who are entering their second trimester, they are also eligible for transitional care up until their postpartum period. And then consumers who have, in the course of treatment, and their provider decides to leave the network for reasons other than fraud or disciplinary action, will be eligible for up to 90 days of transitional care. Or if the client is in their second trimester, at the time through their postpartum care. So below are steps that you as a child advocate or volunteer will take when a consumer needs transitional care. You want to confirm that the provider actually does not accept the plan, right? Because if they accept the plan, then you do not need to follow the rest of the steps. Once you confirm that they do not accept the plan, you or the consumer will need to ask the provider if they are willing to bill as out of network and explain to the provider that they will be paid the plan's in network rate. Sometimes we don't even get to go to the third or fourth step because many providers do not agree to the in network rate. So this is one of the issues that CHA sees very often with requesting transitional care. If the provider is not willing to bill as out of network and accept the in network rate, then there's nothing much that can be done. But if they are willing to accept, then they will contact you, or the consumer will contact the plan, and you will ask someone at the plan who handles transitional care. Because each plan has a transitional care department, and their process is different from plan to plan. So you want to learn about the plan's process so that in turn you can educate the provider about how to bill. Next thing you want to do is be persistent. It can be hard to try to get transitional care because not too many plans understand what transitional care is. And, if the provider say no today, you may want to again ask them again tomorrow, especially if they have been working with that consumer for a very long time. They may be willing or may change their minds and accept agree to the terms. If there are any problems, the consumer has a right to file a complaint, and they should file a complaint. And you will file that complaint with the New York State Department of Health Office of Managed Care. And remember, if that provider is a Medicaid accepting provider, they cannot bill Medicaid at all. So they can't balance bill them. So let's do an access to care case example. We have Rose again. Unfortunately, Rose lost her job and no longer has insurance through her provider. She is seeing a specialist to treat her chronic condition and wants to be able to keep seeing her. What advice can we give Rose so she can continue to see her specialist? Well, first we need to let her know because she lost her job, she most likely lost her employer sponsor insurance. Medicaid is now going to be her primary insurance. And since she does not have third-party insurance, she most likely will be mandated to enroll into a Medicaid managed care plan. You want to explain to Rose how Medicaid managed care works. So you want to talk about what is a network, how to select a primary care provider, and her right to change plans month, every month if she wants. The referral requirement, the appeal rights and cover services and prescription co-payments. And then you want to find out if her current doctor accepts any Medicaid managed care plan. If they don't accept any Medicaid managed care plans, then you want to explain transitional care and help her request it if necessary. Now, let's talk about appeals and grievances to fair hearing rights. And this one, particularly, let's start with fee for service Medicaid. So, one, consumers with fee for service Medicaid can only request a fair hearing when they receive a denial or reduction of medical services, denied Medicaid eligibility, or their Medicaid is being terminated. So they can only request a fair hearing in these situations. A fair hearing is a chance for the consumer to tell an administrative law judge who is from OSADA, which is the New York State Office of Temporary and Disability Assistance, why they think a decision about their case is wrong. It's just simply not correct. The consumer has 60 days from the date of their denial notice to request a hearing. If it's after the 60 days, there is not much that that consumer can do. They would have to reapply for Medicaid if they're actually still eligible. A consumer also have the right to have their benefits continued until a fair hearing decision is issued. This is known as aid to continue. And to receive aid to continue, that consumer must request a fair hearing and request it, the aid to continue, within 10 days from that denial notice. One thing we want to inform the consumer is that with aid to continue, if they continue to receive services and their fair hearing decision is not in their favor, it is possible that Medicaid will recoup anything that they may have paid out because technically the consumer was not eligible during that period between the request for the fair hearing, the aid to continue, and the decision notice. Fair hearing requests can be made online on the OSADA website, which we prefer consumers to do because they will receive a confirmation through the online immediately. But consumers can mail their fair, to request a fair hearing. They can request it over the phone or through fax. Now, consumers enrolled in Medicaid managed care plans have the right to file an appeal or grievance when things go wrong. So it's a little bit different. They don't go straight to fair hearing. They actually will have to file an appeal, an internal appeal, and exhaust all internal appeals before they can actually request a fair hearing. So an appeal is pretty much anything where payment is denied for services already received, prior authorization denied for service not yet received, plan is reducing the services consumer is already receiving. And there are two types of appeals. You have internal appeals, which are filed within the managed care plan, external appeals, which are filed through New York State Department of Financial Services. Now, a grievance is something totally different from an appeal. A grievance is when a consumer is dissatisfied with the care or services they receive from the plan or some sort or some aspect of the plan. For example, they had an appointment and they get to their doctor's office and they're waiting a long time to see their PCP. Or they may have already filed an appeal, but the plan is taking too long to process the appeal. Then they want to file what is called a grievance. Now, fair hearing rights is a little bit different under Medicaid managed care than the fee for service Medicaid, as such as the timeline and exhaustive internal. So, consumers can request a fair hearing, but only after they exhausted all of their internal plan appeals for service denials only. People who are denied Medicaid, like their Medicaid being terminated, or they find that they're not eligible for Medicaid, then they will request an appeal or fair hearing through New York State of Health Marketplace. Once again, a fair hearing, the consumer is letting the administrative law judge know that they think the decision about their case is wrong, and the consumer have 120 days from the date of their plan's final adverse determination denial to request a hearing. They also have a right to request aid to continue if they want their benefits to continue until the fair hearing issued. And to receive aid to continue, the consumer must request it, and they have to request it internal appeal. So if it's at the internal level, they have to request it within 10 days from the notice of their initial adverse determination. And if the plan denies it again and they want to request a fair hearing and want aid to continue, they have to request it within 10 days from the notice of their final adverse determination. And once again, fair hearing requests can be made online, through the mail, phone, and fax. So here is a little chart that helps understand the appeal timeline for consumers who enroll in Medicaid managed care. So the timeline for an internal appeal, the consumer will have 60 days from the date of their initial adverse determination. And once again, they must request aid to continue within 10 days. If it's denied, they can do a fair hearing and an external appeal. So if they want to request a fair hearing, they have 120 days from the final adverse determination. And again, they must request aid to continue within 10 days. They also have a right to an external appeal. And the external appeal basically is the opportunity to appeal to an independent reviewer, and these consumers will appeal to New York State Department of Financial Services. So if they want to file an external appeal, they will have 4 months from the final adverse determination. And also providers can file an external appeal. And if the provider file an external appeal, they will have 60 days to file that external. Just so you know that the fair hearing decision trumps the external appeal. So if the consumer requested a fair hearing and also an external, and they lose their external, but they lose their external, but win their fair hearing, that fair hearing decision trumps the external appeal decision. So we just learned, just to recap, we just learned about MAGI Medicaid, about what it is, who is eligible, so what are the eligibility criteria, the enrollment process to enroll into MAGI Medicaid. Once someone enrolled into MAGI Medicaid, we went over how they access care, how they use their doctors, follow the plan rules, network, PCP, specialists. And we also just finished going over the appeal, grievance, and fair hearing process. So that's all how MAGI Medicaid works. Now, there are some consumers who are not eligible for full MAGI Medicaid because they don't meet the citizen immigration status. If that is the case, then they can apply for what is called emergency Medicaid. And this is Medicaid for the treatment of an emergency medical condition. And only, it is only given to consumers who, like I said, does not meet the immigration status because maybe they are undocumented. However, they meet the other criteria. So they meet the income requirements, they meet the New York State residency requirements, and they fall under the MAGI category. The only way Medicaid would pay for the emergency is if the medical condition meets the emergency medical condition standard, which is a condition that places the person's health in serious jeopardy, a serious impairment to bodily function, or serious dysfunction of any bodily organ or part. Unfortunately, emergency Medicaid does not cover all emergency medical conditions. For example, these services are excluded: organ transplants, um, alternate level of care in hospitals, if someone needs nursing home care or home care, which includes personal care, private duty nursing, home health services, and rehabilitation services, so physical therapy, occupational therapy, or speech therapy. So how do someone apply for emergency Medicaid? They can apply through the New York State of Health Marketplace. So just like any MAGI Medicaid application, they follow the same process. They still would need to renew their financial eligibility annually. And these consumers may be confused and may think that they got full Medicaid because they will receive a Medicaid card in the mail. But that Medicaid card can only be used is when, they have an emergency medical condition. So when that happens, the physician that treated them at the emergency have to fill out a form and certify that the condition meets the emergency medical standard. So they fill out the emergency certification form, and then they submit it to Medicaid. And this is a link to the form. So if you have a consumer who is enrolled in emergency Medicaid or may find themselves eligible for emergency Medicaid, and they had an emergency, you can, and the provider is still billing, you can actually provide the provider with a form and explain to them that they would need to fill out this form in order for Medicaid to pay them for the services. So let's do an emergency Medicaid case example. We have Alex, and Alex's sister calls Cha to see what services emergency Medicaid will cover. Why? Because Alex fell down a flight of stairs and it caused a severe head injury. He has been in the hospital for months and is now being released from the hospital. The doctor thinks he no longer needs inpatient hospital services. However, he will need physical therapy and home care. What information can we provide for Alex's sister? Unfortunately, emergency Medicaid will not cover physical therapy or home care services. So what Alex can do is try to find services through a low-cost clinic or hospital, such as an HHC facility. In HHC facilities, and you will go find more information about HHC facilities and our options for the uninsured, is basically a financial assistance program that provides services to individuals who are uninsured and underinsured. And finally, we get to resources. So that concludes this training. This resources that we list here is some links that you can find more information about Medicaid, because again, this is just a brief overview of the MAGI Medicaid program. It is so much more information that's out there, and that you would need to know and obtain. We couldn't cover everything in this training. So We provided a link with the Medicaid eligibility trainings and information, and this is the New York State of the New York Health Access website. It is one of the most informative websites where you can obtain, I mean, extensive information about public health insurance programs. Then you have the Medicaid managed care model contract. So this is the go-to when a plan denies a service. You want to see what the plan must cover, and so that contract will provide the rules that Medicaid plans must follow. Next is the Administrative Directive and General Information System, and these are pretty much guidance to advise local social services for local districts, LDSS. If you're from New York City, it's called HRA, of policies and procedures that they must follow. So that's to administer the program. We also listed the Medicaid Provider Manual. So this is the eMedNI. So this is information for all providers about how Medicaid works and how to submit a claim. And then lastly is Medicaid updates. So providers are given up-to-date information about the Medicaid program. One update that we always using is the balance billing prohibiting update. And so it gives great detail about how providers should not balance bill and under which circumstances they can. And again, this is not even a complete list of resources. There are actually more. But this is a good to start with. So again, this concludes our training. Thank you for attending, and please view the other four insurance programs so that you can have an overview of all five insurance programs. Thank you, and have a good day.